Welcome to the conversation today. It is Wellness Wednesday, and I am Laurel Brennan. We are inside the Facebook group Brain Wellness and Dementia Prevention, and we are lucky to be joined by Prajakta Apte today, who is a registered dietitian and nutritionist and yoga teacher. And it is wonderful to have you with us today. Welcome.
Thank you. Thank you so much for this great opportunity. I'm very excited.
I'm excited too. So I'm just going to do a quick read on Prajakta. She's a registered dietitian, as I mentioned, who specializes in gut health. She helps people struggling with digestive issues resolve their problems and helps them reconnect with their gut through the healing power of nutrition and healthy lifestyle modifications. She strongly believes in treating the root causes of the symptoms so that one can achieve 100% long-term results. So thank you for being here. Obviously, we are connected because we're both believers in addressing root cause.
Absolutely, yes.
Yes. So we're just going to jump right in. How does one know that they have poor digestive health?
Okay, and this is a common question I get from my clients too. There are many different symptoms that person can experience. A lot of people may straight away think that if I'm dealing with poor digestive health, the symptoms will be related to digestive health. But surprisingly, person can experience digestive related symptoms, or those symptoms could be even non-digestive symptoms. So some of the digestive symptoms could be gas or bloating, constipation, loose bowels. You can go from constipation or loose bowels. You can change in between. There could be even an urgency to use the bathroom. Like at sometimes even my clients have shared that if I don't run to the bathroom right away, I may, I fear of getting an accident, and it is really that urgent. People can have heartburn, what we call it as, or GERD. There could be some other just dull, low pain in your abdominal area overall. That can be a sign of poor digestive health. People could have non-digestive symptoms such as headaches or migraine. People can suffer with skin conditions, and they may not be severe skin conditions, but it could be just some mild rash that comes and goes on its own, or it could be rosacea or acne or eczema. Those are some of the non-digestive complaints. Poor energy, like you feel extremely tired even after getting a good sleep of 7 to 9 hours. People complain that they feel tired in the morning. They are just they're not motivated to do anything. They don't have enough energy. They have brain fog. Brain fog is you cannot focus on things that you're doing, or you may forget on little things. Those are the signs of brain fog. People could have even challenges losing or gaining weight, or even just to improve your muscle mass in spite of even being regularly active physically. So that could be another indicator that you are dealing with some digestive problems. There could be some level of imbalance that has occurred in your gut microbiome.
So that's really a broad picture and a lot of symptoms that connect back to gut health that I imagine a lot of people weren't aware of. You mentioned the skin issues, and if you don't mind, I'm going to share a personal story about that.
Sure. Absolutely.
Because I used to get rashes and hives and eczema and had no idea the reason why. After I was diagnosed with MS, I went on a gluten-free and dairy-free diet, and all of those skin issues went away. I had not connected to the two at all. But in addition to the skin stuff, then I also stopped getting sinus infection and stopped getting like stomach pains. And I have an ongoing, focus on gut health. I think it'll be a lifelong
Absolutely.
focus.
Yeah.
But I just had a direct connection to the skin stuff that I hadn't connected before.
Yeah, and since you have shared this story, even I have a story, not my personal story, but my son, who is now 13, but at that time when we diagnosed him with food sensitivities and realized that there's something going on with his gut health. He was about 9 years old, and he, even as a baby, he used to get a lot of eczema. And the standard solution for that, even by the pediatrician, was put hydrocortisone. And, after applying that ointment or topical cream, yes, eczema used to go away. But in the beginning, even I did not realize that what I was doing is just putting bandages on his symptoms. So again, digging deep into his overall health, his gut health, he's now dairy-free, gluten-free, and even if he accidentally eat a little bit, because he's still 13-year-old, and they don't always listen, as many of us know, he will right away get eczema. So there's a very, very strong connection. We know that when my son is kind of staying away from dairy and gluten, he's just fine, no issues. But if he eats a little bit at the birthday parties or somewhere, he gets eczema. So yeah, there's a strong correlation between your skin health, skin condition, and your gut health.
Yeah, thank you for sharing that and highlighting that, because I think most people don't realize that.
Absolutely, yes.
Yeah. So since we're talking about gut health, and you mentioned constipation and loose bowels, I'm going to go there. So I think what one person thinks of as constipation and another person thinks of as constipation are often different things. So what would be optimal as far as bowel movements?
Okay, and I know if you read more on this, you get different opinions, but I'm going to share what I think, and this is what I strongly believe in. Constipation could be not using the bathroom every single day of the week. So in my opinion, a healthy bowel movement is something that needs to happen every single day, all 7 days a week, at least once. And some people can even go 2 times or even 3 times. I think as long as you have a healthy, well-formed bowel movement, it is considered a healthy elimination. So in my opinion, constipation could be if someone is even going just 6 times in a week, or if someone has a difficulty getting the bowels out. That's constipation, in my opinion. In my opinion, constipation could be even described as if you do not get the feel of getting 100% out. Even that is constipation, in my opinion, too.
Right. That's good for people to hear, I think, as well. So thank you for sharing that. So what would be some possible reasons why people had poor gut health to start with?
Okay. And again, gut health is a big topic. And when someone realizes that something is wrong with my health, or my health is not on track, or there might be some digestive issues I'm dealing with, we all need to realize that these things doesn't change overnight. This is a process. And by the time person realizes that something is not working well in my body, the process was already probably started many days, many weeks, or even in some cases, many years back. And at the initially, when this process starts, of course, the symptoms are very vague and they're very subtle, they're very infrequent. So many people do not notice it. It's normal not to kind of notice them or ignore them. But by the time you realize that, you're getting, these eczema, or you're feeling bloated, or you don't go to the bathroom, regularly, and you do not have a healthy bowel movement, I feel the damage is already happened. So it can take many days, many weeks, many years for your gut to be poor and create that dysbiosis or imbalance. And there are many reasons to it, many root causes to it. Definitely, nutrition plays a big role. And if you are eating what we call it as standard American diet, which is low in fiber, which has bad fats, it is high in saturated fat, it has a lot of processed foods, added sugar in it, that is all can be a big contributing factor to your poor digestive health. Stress is another big reason for you to have a gut imbalance, because stress can have direct impact. The cortisol, especially the hormone cortisol, can have a direct negative impact on the healthy microbes in your gut, and they can suppress the growth of these microbes. So stress, ongoing stress is definitely can be a reason for that. Poor sleep. So if you're not getting enough sleep, the quality of sleep is not good, that can have an impact on your gut health. The exposure to various kinds of toxins around you, and believe it or not, but we are surrounded by toxins. There are toxins around us, poor quality air, water, the personal care products that we use, cleaning products. There could be exposure to toxins in our kitchen if you're using lot of plastic containers in your kitchen. That can all be a source of building toxicity in your body, and that can also affect your gut health. I feel that even some of the factors that we don't even consider, that can be playing a major role. And I feel that even the method of delivery, how babies are born, the natural birth versus C-section birth. The natural birth allows that baby to get a lot of good microbes as baby passes through the birth canal, because birth canal is rich in various different kinds of microbes, the healthy microbes. Baby swallows it, baby gets it all over his or her body, which can help to have a good microbiome in babies, in the baby when the baby is starting his or her life. The C-section babies, they don't have that opportunity to get microbes on their body and to get a good healthy gut microbiome. The other contributing factor is breastfed babies versus bottle-fed babies. Breastfeeding studies have shown that is a good source of getting good microbes to baby from mother and mother's milk, versus bottle-fed babies. They do not have that chance, that opportunity. Rather, bottle feeding has shown to develop or increases the risk of ear infections, which again, many doctors are going to put those babies on antibiotics, which can disrupt their gut microbiome. So all these factors definitely can affect your gut health. And as I said, you need to really go back on your timeline and identify what are the root causes for your gut health, because just randomly following someone else's success story and implementing that plan may not help you 100%. Any kind of negative emotions or traumatic events, physical abuse, mental abuse, emotional abuse, all those things can even contribute to your gut health today. And even if those incidences have happened 10, 15, 20 years before you start with your poor digestive health, it can still have an impact to your gut health.
Yeah. So you mentioned again, I mean, the topic is gut health, and here we are once again looking at the whole person, the whole picture, all, I mean, maybe that's a reason you mentioned stress management early on. And I noticed that you're also a yoga teacher.
Yes.
So people might not necessarily connect dietitian, nutritionist with yoga teacher, but they really support each other when you're talking about stress management.
Absolutely. And I feel, these days our life has become so busy. It's very demanding. It's very challenging. And there is like a competition everywhere, to be honest with you. So I feel that we all have stress, even if we don't feel it. We still, back of the mind, we all have stress. There's always a big to-do list for us. And even if you scratch things off of that list, new things get added. So that list, in my opinion, never gets shortened. So practicing daily stress management, no matter whether you think you have stress or you don't have stress, is absolutely important. It's just like I always tell my clients, it's just like taking a shower or brushing your teeth. It's a part of your daily routine. You should practice stress management, whether it is meditation or yoga or just deep belly breathing or just journaling, whatever feel comfortable and whatever you think will be good for you and your schedule. You need to be consistent with that practice.
Yeah. Thank you for giving such a good broad background into so many things that can contribute to gut health, going back to, as you said, to childbirth.
Mm-hmm.
Yeah.
Absolutely.
And the number of times you were on antibiotics as a
Oh,
kid.
yeah. Mm-hmm.
Yeah.
Yeah.
So yeah, when I did my timeline, it was like, wow, I know all the reasons why I had poor gut health, because I had tonsillitis many times, was on penicillin many times, you know.
Correct. Yeah.
So definitely plays a role.
Yeah, absolutely.
Okay, so if somebody has poor gut health or they're hoping to avoid it, what are your favorite tips that you could share with others, with the audience, about how they can help their gut?
Okay, perfect. And again, to begin with, I'm going to share the tips, but those tips, literally, I'll be very honest and upfront here, but those tips are general tips. If you are struggling with digestive issues, you really need to have a customized approach. It is not a cookie cutter approach, because everyone's healing journey is very unique and different. So if you are struggling with gut issues, I would encourage you to go seek help from an expert, whether that's a functional medicine doctor or a health coach or a registered dietitian who knows what they are doing and who will treat you person as a whole and will not put bandages on your symptoms. But definitely look at your diet first, the nutrition, what type of food choices you're making. If you feel that your diet is heavily loaded with processed foods, bad fats, trans fats, your diet does not have enough fiber, you probably want to start making changes in your nutrition or diet first. Remember that the microbes, the good microbes in your gut microbiome, they are vegetarians and they love to eat fiber. So make sure that you get enough fiber in your diet. I always tell my clients to make your diet 75% plant-based. Does that mean you need to be a vegetarian? No, you don't need to be vegetarian, but definitely enough focus needs to be given with a lot of fiber-rich foods, variety of fruits and vegetables, variety of beans and lentils, nuts and seeds. Make sure that you get soluble as well as insoluble fiber. So that will be the first thing. Stay away from processed foods and stay away from foods with added sugar, foods with additives, artificial sweeteners, colors, flavors, because all those will not help you improve your gut health. The second thing is stress management. Again, I'm repeating myself here probably, but stress management is extremely important. Even if you don't feel you have stress, you need to get into some type of stress management technique, and doing it for a few days and then taking a break or, kind of falling off the wagon on this is not going to help you. You need to be consistent. Even if you want to spend just 5 minutes every day, be consistent with that and practice a stress management technique that you love. It could be yoga, it could be physical activity like exercising, it could be just going out and taking a walk in the nature, listening to the music, or deep belly breathing. Whatever it is, you need to engage yourself in stress management every single day. Sleep is another big thing. You need to develop a good sleep schedule. So getting to bed on time at certain time and following that routine is very, very important. You want to make sure that you are not turning on any electronic devices at least 1 hour before your bedtime. Make sure that your bedroom is cozy and it's like, nice environment, which will be very conducive for your sleep. So developing a good sleep schedule is a very, very important. The fourth tip I would like to give you is stay away from toxins around you. And I understand that there's no way we all can be 100% free of toxins. As probably you have read this somewhere, but scientists have shown that average adult carries 700 different toxins in their body. So there's no way we can be completely toxin free, but you can certainly minimize your exposure to toxins. So look around you, look around your workspace, your home environment to see what different types of toxin exposure you have. It could be through cleaning products. It could be through your personal care products. It could be through the utensils and pots and pans that you use, which have, worn off the coating, the Teflon or whatever, that coating is gone away. That can be an exposure to toxins. If you are microwaving stuff in plastic containers, or if you're using like plastic containers to store your leftovers, all that can be a source of toxin. Check your air filters, check your water filters, all those things. If you use good quality air filters, water filters, definitely you can reduce your exposure to toxins. Changing to organic diet. Again, you don't need to be 100% organic, because I understand that it is expensive to eat everything organic, but at least try to focus on getting organic fruits and vegetables. If you are not aware, there is a website called ewg.org, and they have a list of dirty dozens and clean 15s. Basically, what they are telling is the fruits and veggies that you must buy organic versus fruits and veggies that are nice to have organic. So go to the website, check out that list. You can download that, and I believe they update that list every year or so. So make sure that at least you follow those guidelines. So eat organic as much as you can. These will be some of the tips that I would like to share with you, which can help you get on the right path of healing journey.
Yeah, that's a fantastic list. I appreciate, and I'm sure others appreciate that list. And, sometimes it can be a lot. And so I encourage people to start somewhere. Yeah. Start somewhere.
Baby
start
steps.
Looking, baby steps. There's always room for improvement. And start where you're comfortable starting.
Correct. Yep, absolutely.
So this might be a controversial topic, and you hear mixed opinions on probiotics. So what is your opinion on probiotics? Yay or nay?
Okay. So first of all, I know probiotics have received a lot of popularity in last few years. And in my opinion, it's nice to take a probiotic, but you cannot 100% dependent on probiotic, because fixing your gut and healing your gut is definitely beyond probiotic. If that would have been a case, if probiotics would do all the magic, then I'm sure everyone in the world will be perfect, because that's a very easy solution, right? So probiotics are nice to have, but you don't want to completely dependent on it. Probiotics alone will not help or heal your gut 100%. At the same time, many people miss on the fact that they also need to focus on getting prebiotic foods in their diet, because I'm not sure if you guys know this. I'm going to anyway explain it. But what are probiotics? Probiotics are either in the form of supplement, or there are some probiotic foods in our diet which contain the live strains of healthy microbes. And through those foods or through those supplements, we are adding those strains in our body, in our gut microbiome, to improve or increase the overall count of good healthy microbes. So those are probiotics. But as you know that these probiotics, these live microbes, they need their food. And if they don't have their food, they will not be surviving, and they will not populate more microbes in your gut. So prebiotics are basically the foods that your probiotic will need. And prebiotics are generally fiber-rich foods. Some of the examples are asparagus, or Brussels sprouts, or variety of beans and lentils, apples, oatmeal. Any fiber-rich food is basically a prebiotic. So it is equally important to take prebiotics every day in your diet. Many of my clients will say, but I'm taking a probiotic, I'm still dealing with digestive issues. Well, if you are taking a probiotic, but on the other hand, if your diet is completely standard American diet, those probiotics is a big waste. You're definitely wasting a lot of money on those probiotic supplements. So make sure that you have both to give you 100% results. But at the same time, as I said before, do not 100% rely on probiotics. You need to work with each and every piece of this gut health puzzle.
Right. I know this is still very early science, and they're still trying to figure out if there are certain strains of probiotics that are connected to certain health benefits.
Correct.
And certain probiotics that need to be fed by certain foods. I heard about a study. I just heard about it this year. I'm not sure if it's how old the study is, and I'll try to find it and put it in the show notes. But it's about Akkermansia in particular, where Akkermansia, people who had Akkermansia in their gut were having better results with their cancer treatment with the immunoaugmentative piece that was really bringing them kind of back to life after they had, the chemo. And what they found is that people who did so much better on that immunoaugmentative therapy would have really high amounts of Akkermansia, which love pomegranate. And I wasn't eating pomegranate at all before that. I said, well, if I have any Akkermansia in there, I better give them the food that they need. So started eating some pomegranates.
That's true. Even there was one study I read, and again, as you said, this whole area is still need a lot of research in this area, but taking the same type of probiotic will not help you long term. It will not give you the same results long term. And that's why this study was showing that you need to change your probiotic, because especially if it's a supplement that you're taking, one pill or one capsule that you're taking, it's not going to have all different kinds of good strains of those good healthy bacteria or microbes in them. So you need to change the strain of probiotic every few months, is what this study was showing. And I thought that was very interesting.
Yeah, thank you for sharing that as well. So I've had conversations with friends and clients in regard to their IBS or irritable bowel syndrome, whether it's loose bowels or constipation or mixed of the two. And sometimes it's just seen as a nuisance, but not a health issue. So are some of these gut issues or the skin issues that are symptomatic of our gut issues, are these early warning signs that we should be paying attention to that might prevent problems down the road?
Absolutely. I think definitely 100% you're right. Any of these symptoms that you're dealing with, whether this is IBS, constipation, or diarrhea, or mix, or it could be even ulcerative colitis, I feel that definitely is an early sign for poor gut health or some digestive problems in future, because studies have shown that your gut health is extremely important, and there is a strong correlation between your gut health and your skin health, your gut health and autoimmune conditions, your gut health and diabetes, your gut health and hormone level. Like pretty much any part of your system, it is connected to your gut health. So absolutely, if your gut health is poor, you will end up having some or the other of the problems in future. And as I said earlier, it's a process. So it's not going to change everything in a day or two or in a week or two, but longer you wait or you ignore things, it can get complicated, and you may develop one health condition which can lead to the second condition, and it can make things more and more complicated. So absolutely, I feel that any sign that your body is trying to repeatedly give you, whether it is bloating, whether it is your headache, whether it is your heartburn, or whether it is frequent episodes of your IBS, you should not be ignoring those, because those are the signs your body is trying to tell you that, hey, watch out, there is something going on in your body and you need to pay attention to that and get right action on it.
Yeah. So since we're specifically talking about brain wellness and dementia prevention, is there a link between gut health and brain health?
Yes, again, the common question many people ask me, and yes, it is very, very strongly, studies have studies have shown that there is a strong communication that happens between our gut and brain. So in other words, our gut and brain are connected, and they are connected through a nerve called vagus nerve. And this is a thick nerve that runs from your brain down to your digestive tract. And there are many neurotransmitters that actually exchange signals, and they communicate between your brain and gut. So what I would like to share, one example here is, if you have ever felt butterflies in your stomach, and what that means is, if you have to, if you're under stress, or if you're anxious about something, if you have a big deadline coming up, or if you have some presentation in front of 100 or 150 different people, there is some butterflies that we all have experienced at some point in our life. Or even some people have said that when they are under stress, they have to rush to the bathroom. They have that big bout of bowel movement. Those are the signs that when you are under stress, your brain is trying to communicate with your gut, and that can be a communication that happens from your brain to your gut. On the other hand, if you ate something that is not well tolerated by your body, you may notice that you are in a bad mood next day, or you have some headaches, or you get some migraines. And that's the way your gut tries to communicate with your brain. So yes, there is definitely a communication that happens between your gut and brain, and your brain and gut all the time. So what can happen in your gut, your brain can sense it. And if you are under stress, if you are anxious, if you are depressed, that can even have an impact to your gut health.
Right. Mm-hmm. And we haven't gotten into, quote unquote, leaky gut or increased intestinal permeability, but when there's leaky gut, there's also risk for leaky brain. I don't know if you want to share any more about that, or is that?
I mean, it's up to you. It's a big topic, but definitely leaky gut, I don't know how many people know what leaky gut is, but basically leaky gut is the lining of your gut, or the mucus layer in the lining of your gut. It gets it gets thin out, or it forms a little gaps in between the cell, in between your gut cells, basically, that allows the free entry and free access to unwanted substances, pathogens, and toxins to enter. And at the same time, the undigested food particles to escape into your bloodstream, causing high level of inflammation. And that is called leaky gut. Many people struggle with leaky gut, especially when they have poor gut health, without even realizing that they have leaky gut. And it is extremely important to take care of that leaky gut. Make sure that the lining of your gut looks nice and healthy and thick. So I always tell people that when the gut lining is healthy, it looks like my closed fist, where you see no gaps here all around my fist. But when you have leaky gut, this lining looks more like my open fist, where you see the gaps, and through these gaps, these unwanted substances can get in, the undigested food particles can escape in the bloodstream, and that is definitely not a good sign. It can also lead you to develop leaky brain, because there's a gut-brain barrier, and that also gets affected. And majority of the times, I think that gluten plays a big role in that. So if you take out gluten 100% from your diet, this is all can be fixed.
Yeah. Mm-hmm. Thank you. I think we need to have you on for another episode, so we can get into the big details about. Yes. I mean, we could talk for hours and hours and hours, but you have highlighted some of the big key areas that I think are really important for people. And so how could people find you, get in touch with you? What are you doing? How do you work with people?
Sure. So I am a registered dietitian, and you already know this. I have my practice. It's a virtual practice. I work closely with people who are struggling with digestive issues. My main focus is to help those people put their gut health back on track through all natural remedies. So through changing the diet, lifestyle, some natural supplements whenever it is necessary. If you are interested in knowing more about my services and how I will be working with you, you can certainly book a 15-minute complimentary call, and I can share probably a link with you, or you can even check out my website, rightnutritionworks.com, and the website has this link where we can schedule a 15-minute call. I would love to know what is going on with your health, what are your health goals, and then we can discuss about the further steps. I do have a gut healing program, and again, that program is not for everybody out there, but we definitely want to make sure that if it is a right fit for you. So check out more details on my website. That's the best place. You will get to know what I do and what I offer to my clients.
And that's Right Nutrition Works, correct?
Right. Yes, rightnutritionworks.com. Mm-hmm. Yes.
Okay, great. Thank you. And I know you also recently started a podcast.
Yes, exactly.
So can you share about that?
Absolutely. Yeah. And this is my new baby, my podcast. I launched it on September 12th. I have my podcast called Your Gut Health Puzzle Made Simple. This podcast, you will be able to listen to the episodes on all major platforms. Every Wednesday, I release a new episode. My goal is to really make your gut health puzzle simple, because I know this puzzle could be complicated. There could be some missing pieces of the puzzle. The puzzle pieces could be broken, scattered all over. So through my podcast episode, I'm going to help you put those pieces back on the right places so that you can be on the right path of your healing journey. Because I'm sure there are some of you that are struggling with digestive issues for many years. You have tried many different things. Some things have worked in past, but they're not working anymore. And it's very confusing, frustrating. More Dr. Google you get help from, you get more confused. So if you want to follow me for my podcast and listen to my podcast episodes, I'm going to walk you through different topics of this gut health puzzle, give you some easy to implement action steps so that you can implement those right away to see some changes, positive changes happening in your health.
Yes, thank you. That is needed, and we're grateful that you are going down that path so you can share your knowledge with others. Thank
absolutely.
You.
I'm very excited. Yep.
Yeah. Congratulations. That you launched it. I know that's a big undertaking. So congratulations.
Thank you. Yep.
So thank you so much for spending your time with us today. Is there anything else that you'd like to share before we wrap things up? Did I forget anything?
I would say that the 2 cents that I would like to share is, do not ignore any symptoms that your body is giving you, because in my opinion, our body constantly tries to talk to us. It's just we sometimes don't listen to our body. We ignore, and we try to take our body for granted. But if it really crosses its threshold, it's going to burst out. So listen to your body cues closely. Do not ignore any symptoms. Get help from a professional who really knows what he or she is doing, and who is going to treat you getting to the root cause of the problem, and who is not someone who's going to put bandages on your symptoms, because bandages will come out. You may feel some changes happening right away, but remember, those will not last longer. So definitely take care of your body, especially your gut health, because it is a seat for all different problems that can happen to you in future.
Yeah. I'm getting lots of ideas for future episodes, so stay tuned.
Awesome.
Yeah. Thank you so much for your time today.
Absolutely. You're very welcome. And it was a pleasure to be here as a guest with your audience. Thank you very much.